Hello and welcome to today's webinar from LGC AXIO Proficiency Testing. Thank you very much for joining us. My name is James Sizer and I'm the Global Senior Brand Manager for AXIO Proficiency Testing here at LGC. And it's my great pleasure today to be joined by Dr. Michael Walker to present a webinar on Allergen Action, and specifically it's the latest from the laboratory. Just before we get started, a little bit of housekeeping. The benefit of today is that we are joined by experts, so this is a great chance for you to ask any questions you may have on the subject of allergen testing and quality control in this area. So what I would say is please do enter those questions into the questions box using the GoToWebinar function, and when we get the opportunity at the end of the session, we will be able to review at least some of those questions, hopefully, and get some answers. But similarly, if we don't have time today to address every single question, or we don't necessarily know the answers, we will come back to you directly on those. So please do ask the questions as and when they come up, and they will be addressed towards the end. Just to alert that attached to this webinar are a couple of handouts of relevant materials from AXIO Proficiency Testing on allergens, so please do have a review of those, and similarly, if you have any questions, please let me know. So moving on to the plan today. So we are going to spend some time today exploring the latest developments in allergens analysis, but specifically around the critical roles that our laboratories around the world play in both assessing and then managing risks associated with allergens. It's a really hot topic. It's pretty much everywhere at the moment, and it impacts in a number of different areas of consumer safety, and that includes things like food labeling, as well as the actual scientific part of protecting people from allergens that could be harmful to individuals. So AXIO Proficiency Testing supports laboratories around the world that are doing testing with allergens with PT samples, and we have a number that are dedicated to allergen testing. We'll cover some information on that later on. And ultimately, this is one of many webinars that we do as part of a series here at AXIO Proficiency Testing. We always enjoy sharing what knowledge we do have and what knowledge our partners and friends do have in different areas. So please do make sure that you join regularly to get the latest updates from us. And it's our great pleasure to share this with you. And we are very happy that you are joining us either live or watching a recording at a later date. So thank you. So today, we are actually very lucky today to be joined by Dr. Michael Walker. Michael previously worked with LGC and actually held the position of the head of the Office of the Government Chemist in the UK. And ultimately, Michael has enjoyed and put a great deal of work into a celebrated career that is dedicated to science for a safer world, which is a big part of LGC's remit. So he is a natural member of the LGC family and a perfect fit to join us today. Currently, Michael is the honorary professor at the Institute of the Global Food Security at Queen's University in Belfast. But beyond that, he is an expert in a number of different areas, and that does include the analytical chemistry of food, water, air, and consumer protection. Michael has done a great deal of work in the world of allergen testing and food labeling. So it's with great pleasure that we welcome Michael. And rather than hearing too much more from me, I think I'm going to hand straight over to Michael, and we will start making our way through today's content. So please do enjoy. Please ask the questions in the box, and we'll get to them at the end. And Michael, over to you, please.
Thank you very much, James. And what we're going to cover today is what is food hypersensitivity, something on risk analysis and risk management, and then we'll concentrate on analysis for food allergens, something about reporting, what's new and what's happening now in the world of food allergy and allergens, and some conclusions. So what is food hypersensitivity? Well, if we have the next slide, please. In the spectrum of adverse reactions to food, there are predictable events, and that would be if someone eats, or if we were in a meeting and we all ate sandwiches contaminated with pathogenic salmonella, we'll all get ill. That's a predictable reaction. But there are unpredictable reactions, and in the sense that the person to whom it happens doesn't know it's going to happen, and it doesn't happen to everybody. And they can be non-reproducible, like food aversion, and that's a fascinating topic, but we're not going to deal with that today. And they can be reproducible. And what I mean by reproducible is that when it's happened to someone, when they've had a reaction, they tend to go on having a reaction to that particular food. And if it's that kind of occurrence, reproducible adverse reactions to food that are not caused by predictable reactions such as pathogens, that's food hypersensitivity. And there are various types of food hypersensitivity. One is immune mediated, largely driven by immunoglobulin E produced by the human immune system. A second type is autoimmune mediated, of which the principal manifestation is celiac disease. And then there are food intolerance reactions to food, lactose intolerance, intolerance to FODMAPs, to histamine in food, scromotoxic food poisoning. Again, a vast topic where analysis is very important, but we're going to concentrate on the Ig mediated. So next slide, please. A good example is wheat, and wheat contains proteins, and what happens in that is we've got two options. So if I can ask James to click through the options for me, we're going to see in a minute something come up about what wheat is capable of doing. Yes, so we're either going to have a celiac reaction to wheat, and that's due to the gluten, and it's a chronic adverse reaction to the gluten, and there are official codex and EU limits for gluten-free and very low gluten. But apart from that, the other gluten and any of the other proteins in wheat, the albumins or the globulins, any of them can produce an IgE-mediated reaction, and that's an acute adverse reaction to any of the proteins in wheat. And it can go on to have the potential for anaphylaxis, which can rarely go on to be fatal. And are there official EU or codex limits for IgE-mediated allergens? No. But there are voluntary reference doses, and we'll come back to that later in the presentation. The next slide, then, we'll talk a little bit about celiac disease itself. This affects up to 1% of the population, may present at any age. Many people with celiac condition are subclinical, and a lot of them don't know they have it. But it can produce tiredness, bloating, wind, nausea, diarrhea, and a range of other problems, including the increased risk for some cancer types. And the trigger protein is gluten, which is a name for the protein fraction from a number of cereal grains containing prolamins. And prolamins include the aqueous ethanol-soluble proteins of wheat, secalins in rye, hornbeans in barley, and avenins in oats, although there's a whole topic about the potential real toxicity of oat epitopes. And the images on this slide show on the left damaged villi in the intestinal mucosa caused by the autoimmune reaction to gluten, which triggers the malabsorption, which gives rise to many of the adverse symptoms of celiac condition. And on the right, then, you can see that this is a histochemical slide of the restored villi after a period of abstinence, of avoiding gluten. So celiac disease affects a lot of people, representing the 1% of the population, and is an important aspect of analysis. The next slide then is really concentrating on IgE-mediated allergy, and this occurs in two steps: sensitization and elicitation. So the first step is where the person's immune system encounters the allergen protein, either because it crosses the gut barrier and enters the systemic circulation, captured by dendritic cells, or it gets in through air allergens through the nose, it's breathed in, or through damaged skin. It comes in through the damaged skin that you might have in eczema. And once captured by the dendritic cell, the protein's broken down into peptides, and in those who are predisposed to do so, a naive T cell flips from a Th1 to a Th2 or other types of T cell response, which generates allergen-specific immunoglobulin E, which then goes into the systemic circulation to coat mast cells, and that's the sensitization process. And the mast cells then are resident in the body, waiting for the next step, which is the sensitization or elicitation step. And this is where most often comes through the gut. The allergen penetrates the intestinal mucosa, and the epitopes and the allergen protein cross-link the IgE on the mast cells, triggering the mast cells to release inflammatory mediators such as histamine, but also cytokines and other molecules, and they cause the reaction, which we can see on the screen here, the gastrointestinal symptoms, swelling of the mouth, diarrhea and vomiting, and then itch, asthma, hives, angioedema, which is release of fluids from blood vessels, which contributes to the swelling. And if a multi-organ system effect takes place, it can lead to anaphylaxis, which is sometimes but rarely fatal. So that's a snapshot of how IgE food allergy is triggered both by the sensitization and elicitation stage. So what do we do to risk manage and risk assess all of this? Well, on the next slide, we'll see a risk assessment, risk management process. The assessment then depends on limits, thresholds, and we have them on the back of a lot of research, a lot of published research, harmonized and accepted the world over now, gluten-free, less than or equal to 20 milligrams per kilogram of gluten, very low gluten, not more than 100 milligrams per kilogram. And for allergens, there are no official limits other than for sulfites, which is not an IgE-mediated allergen. But we do have these voluntary reference doses, and the most well-known at the moment is the Allergen Bureau of Australia Voluntary Incidental Trace Allergen Labelling Program limits, the ED01 limits, and there are a few there on the slide. What are the risk management options then? Well, essentially, the risk management is for the consumer who is allergic to avoid the trigger allergen, and for food businesses to help people who are allergic avoid the allergen by labeling. And that labeling is the key mechanism, and that's why that key mechanism of labeling and giving the information necessary is mandated in law in most jurisdictions. Now, we talked about reference doses. So what do I mean by a reference dose? On the slide, you'll see on the left a graph, and on the graph, you'll see a series of red dots. The red dots are occasions on which, in clinical studies, people have been made ill by consuming an increasing dose of the allergen to which they're allergic. And so you can guess this is not a trivial exercise. That's why it's done in a clinical setting. And once that information is available, so point data on the amount of allergen it took to elicit objective symptoms through increased amounts given to a population, a small population in the clinic, then we can fit a curve to those data points and you get a dose response curve. As you can see at the bottom of the dose response curve, the way in which you fit the curve may give you a slightly different answer as to, well, what's the lowest dose you can see which will trigger something. But through a lot of research, the lowest dose, which will affect 1% of the allergic population, is known for some allergens in the vital system. And the vital system also gives the ED05, and that's the eliciting dose for 5% of the allergic population. And very recently, the FAO has published recommendations on an ED05 level. You can see some of them there. So what do we do with this? Then we can work out a threshold, which is the reference dose in milligram from one of these tables, divided by the reference amount, which is the amount of food containing the allergen that the person has eaten. And we multiply by 1,000 to get that into milligrams per kilogram as allergen protein. Let me show you some examples in the next slide. So here we have again the table of values of the reference doses and the equation. So consider a ready meal found to contain unintended egg. What is the risk? The meal weighs 350 grams. So it's simply plugging the numbers into the equation to get an ED01 threshold value. It's 0.2 from the table divided by 350, the weight of the meal, times 1,000, we get 0.6 milligrams per kilogram. If we want to know an ED05, it's from the table 2.3 divided by 350 times 1,000, 6.6. So 0.6 and 6.6 milligrams per kilogram allergen protein, egg protein. These are the threshold amounts, the critical concentrations. And if we analyze the food, if it's below one of these critical concentrations, we can be reasonably sure that it's protective of that proportion of the allergic population. And we'll say more about that when we come to the final slides on the FAO position paper. Now, is it that simple? Well, no, because how do you know how much the person has eaten? It's okay with a ready meal, but René Crevel, who teaches on this and is the doyen of this kind of risk assessment process, will always give the example of a loaf of sliced bread. Well, you're not going to know whether the person eats one slice or every slice in the loaf. And so you've got to be careful about the amount consumed. It may not be the portion size that's on the label. It may be more than that. So you need to be thinking about that. And there are published papers to give you those sorts of numbers. And if you want to know more about allergen risk assessment, there's a free to access webinar by Ben Remington, Professor Ben Remington, on the LGC Government Chemist website, and the link is there on that slide. And you'll get these slides later, so you can go over them at your leisure. I'm not going to cover everything that's on each slide, but you can get this webinar to give you a really good introduction to what risk assessment is. So that's what we do with risk assessment. And what are the priority allergens? Well, internationally, they're agreed at Codex, and Codex has a small list of allergens that are regarded as priority for very good reasons. The EU has the largest list on the planet of 14 allergen groups. The USA tends to go along with the Codex allergens by and large, and recently sesame was included both recommended for inclusion in the Codex list and will be included in the US list, effective from legislatively effective, and you have to have regard to it from 2023. How do you find out globally then what the allergen priorities are in the jurisdiction of the country that you're selling into or analyzing for? Well, that's on the next slide, and you can see that it's from the University of Nebraska, Steve Taylor, his food allergy research and resource program, and the link is on the slide. And that's the only open access resource which will give you as good as humanly possible information on what allergen legislation mandates for labeling across the globe. Please note the disclaimer, which I've reproduced in full. It's difficult to keep this information up to date. It really is the responsibility of the food business to make sure they research their market, their geographical market, to make sure what the legislation currently is in that particular market. But here's an open access resource you can start with. There are other resources behind paywalls, and you can pay your money and you take your choice, make your choice. Okay, so where do we go from here? Let's get back to analysis, which is, I guess, what you're really interested in. And the first slide I want to show on this gives an overview of the types of analysis which can be carried out with regard to allergens. And we're going to concentrate on the green column here, routine laboratory analysis. And as you know, it'll be either ELISA, PCR for the DNA, or some form of liquid chromatography and mass spectrometry. There are research proteomic applications which are related, polyacrylamide gel electrophoresis and TOF-MS. There's diagnostic tests, and there are also routine on-site analysis, such as lateral flow devices, which depend on ELISA principles. But we're going to concentrate on ELISA, PCR, and LCM-SMS. And the first slide on that score then will be looking at ELISA, and gluten and IgE-mediated food allergens are big protein molecules. RH1, one of the allergen isoforms in peanut, is about 65,000 Daltons, and compare that with aflatoxin B1, the small molecule problems, a molecular weight of 312.3. So these are big molecules, and without ELISA, their detection and quantification would not be routinely possible. But you need to bear in mind that different ELISA platforms often give different quantitative results. Why is that? Because the ELISA platforms, the kits, are raised to different antibodies, and they have slightly different targets for the same allergenic food. It may target different protein isoforms, and then the proteins themselves are subject to modification, both post-translational modification by, for example, glycosylation, but also in the food where there's aggregation with food components, lipids and carbohydrates, and the pH and heating history of the food may change the structure of the protein, which means it has, alters the binding efficiency with the antibody. So, and you can see that their PT schemes may often turn up multimodal results for allergen analysis. The polymerase chain reaction, PCR, for DNA, well, sometimes you have to use it because there's no ELISA, such as for celery. And it's often advantageous to bear in mind what the advantages are, because DNA is a more robust molecule than many proteins. PCR offers advantages of sensitivity, multiplexing, and the great sensitivity, the great specificity of PCR for the DNA of the species. And if you've got a PCR laboratory set up with its integral isolation facilities, then the workflow is relatively rapid, uncomplicated setup, and there are a whole lot of real-time PCR instruments out there and kits that you can buy in and use. The problem is often stated that the hazard, the protein, is not the target for DNA, it's the species. But really, in most cases, if you've got a PCR positive, then you need to take it seriously. It's not often that the proteins and the DNA are separated. More importantly, to remember that for egg and milk, DNA methods aren't applicable, since you can't differentiate between, was it from the egg or the chicken meat, or from the milk and the beef. The DNA is the same. Quantification is possible. You can easily get it on a copy number basis, but to be more meaningful, you have to quantify with regard to reference materials using which you set up the calibration curve, although digital PCR may be capable of absolute quantification without a calibrator. So pluses and minuses for PCR, but a great adjunct to ELISA. Another great adjunct to ELISA is LCM-SMS, or some form of liquid chromatography mass spectrometry on the next slide. And that's something which is has become more applicable to food allergens over the last 5 to 10 years. And the process really starts with getting the protein out in the same way as you have to get it out for ELISA. Then you add an isotopically labeled peptide and use enzymes to digest the protein. And there are a suite of enzymes, principally trypsin, which are known to snip the protein at specific points. And what you get then is a set of peptides released from the protein, including our labeled internal standard. Clean that up and present it to the instrument. And at that stage, so you've got a peptides with between 6 and 12 amino acid residues. You've got to remember that's still a pretty big molecular weight, but most of these will be doubly or triply charged. So the MZ is now comparable with the MZ of routine small molecule work in the like of pesticides, vet res, or mycotoxins. And again, as LCM-SMS is the gold standard for small molecule identification and quantification, so it could be for food allergen proteins. On the downside, it requires high-end instrumentation and highly skilled operators, but it may be the best approach for critical problems. Okay, I just want to touch on complementary techniques, because in highly critical situations, you may need to use two approaches, either two different ELISA platforms, and I'm grateful to Dionysus Theodosis for pointing this out. We were talking recently, he said, look, okay, two ELISA platforms, two different kits is fine, but you need to make sure they've got different antibodies and, if you can, different calibrators. So you get a more true picture of what the quantification might be. You might want to use ELISA plus PCR, or ELISA and LCMS/MS, or all three. And using all three was how we in the government chemist laboratory solved the, was it almond or was it Mahalem problem? And you can find all about that in the papers that are there. Most of them are open access if you're interested in that one. There's a good overview in JAOAC open access, so I'll not dwell on that. That's a whole different topic for a new talk if you're interested. So sometimes you've got to use complementary techniques. Going on then to quality control. For ELISA, well, you know it yourselves. It's validation, and during the validation, you get your staff familiarized with the assay. And the validation will give you the performance characteristics, the bias, the LOD, LOQ, precision, down to the uncertainty. And there's a great little piece of advice on the Institute of Food Science and Technology website, IFST, how to choose a lab. And in that information statement, there's a discussion on each of the different performance characteristics and how you achieve that in your validation. But for ELISAs of allergens, a special focus has to be on cross-reactivity, intermediate precision, day-to-day variation, and matrix interference. And of course, as with all ELISAs, keeping an eye on your pipetting, making sure your multi-channel micropipette is stored with care, serviced regularly, calibrated regularly. Plate washing is a really key thing. You've got to do it carefully, thoroughly, according to the kit instructions. The calibration curve will come along with the kit, but you might want to use reference materials to do your own calibration, to check the result that you think you're getting is real and how it relates to the reference material value. And you will, of course, want to indulge in PT rounds to compare your result with other laboratories. And the big thing is to follow the procedure. Why is that? Well, the antibody-antigen reactions in ELISA and the time scale to do the assay often don't go to equilibrium. So you've got to be really careful about the timing and the incubation temperature, because you're dealing with a non-equilibrium situation. In terms of quality control for PCR then, these two diagrams are taken from Tim Wilkes's chapter in our book on DNA for food authenticity, but they apply, and a lot of the information there applies equally well to allergen analysis. And on the food authenticity network, you can see there's 10 or so 30-minute webinars on a whole host of aspects of PCR, from what is real-time PCR to how to validate it. And it's well worth a look into the training section of the Food Authenticity Network. But to summarize what's on the screen now, the DNA extraction is important, and then you've got to look at the DNA for quality and quantity before you go on to do the PCR. And those webinars that I mentioned will show you how to do that, and Tim's chapter in the book will also give you a really good grounding on how to do that. Moving on then to LCMS/MS, it is necessary to use gravimetric standards to assess recovery. You've got to have calibrator peptides to generate a calibration curve. You've got to know the molecular weight of your protein. You've got to be able to relate the peptides that you measure through back to the protein. There are rules in the literature for the uniqueness and confirmation of identity of the peptides, and you can see an experimental design workflow there on the screen, which I'm not going to go through, but you can tell just looking at it that it's reasonably hard work, but you can multiplex and once validated, you can pile them high and keep your LCM SMS going over the weekend and all of that, the usual things that make that technique so attractive. But you must validate, you must use RMs, and you must participate in PT to compare your results, and we'll see a bit of that later. So moving on then, we talked about reference materials, and so it wouldn't be right not to leave you with the impression of what I think are good reference materials for allergen analysis. There's a lot out there, and I'm picking on two. You can easily see why, but the objective reasons for this is that reference materials from national measurement institutes, whether it's LGC itself or NIST or the Australians or Hong Kong, a whole host of every major jurisdiction has its own national reference laboratory, national reference measurement laboratory. So those are the best characterized, or you can see organizations and NGAs such as Monica, who have published on their allergen reference material. So the information's out there. So we've got two that I'd like to draw your attention to. One is for peanut, and the peanut defatted peanut flour is available, but also a chocolate dessert matrix incurred at 10 milligrams per kilogram as peanut protein and a negative control. And then very recently, we released, Jill Holcomb released an allergen kit with milk, egg white powder, almond, hazelnut, and walnut. And again, the 5 ingredients and a blank and a fortified material are available, and it was produced with partial funding from the Food Standards Agency. And then in the next slide, a bit more detail about that reference material kit. Gravimetrically assessed values for the allergens that we provide, and uncertainty calculation, homogeneity and stability studies, additional information including ELISA kit values to show you how different ELISAs react to the reference material. And you can purchase the raw materials individually or as a kit with materials, the raw materials and the incurred and blank, and the kit product code and web link are there. And the web link contains, you don't have to buy it, but you can download freely available half a dozen pages of information on this kit before you make your choice. So that's a plug for my colleagues in LGC Standards and their reference material producing abilities, which are historically very experienced. So moving on again, how should we use them? The individual allergenic foods can be used as calibrator extract solutions, either for a kit manufacturer or for you to check how the kit's doing in your lab. And you can use the raw materials to spike food matrices, because let's face it, there's never going to be a reference material for every matrix that you'd be asked to analyze. But you can do spike recovery experiments using the raw materials to get an idea of the true result. The blank materials are, of course, no template controls to check for in-laboratory allergen cross-contamination and for doing LOD calculations. And then, of course, the fortified matrix at 10 milligrams per kilogram allergen protein in a chocolate-type matrix will give you the opportunity to assess how your result corresponds with the true estimate of allergen in a question product. Do reference materials solve all problems? Not necessarily. If two kits measure completely different things, completely different epitopes, then a reference material will improve the comparability of results, but the beneficial effects are not always observed equally for all kits or even for all matrices with the same kit. And there's a key paper from Gavin O'Connor's research group when he was with the JRC, the European Commission Laboratory in Giel, and that's published, and you can see the reference there, and that's a paper that is well worth having a look at if you're doing gluten analysis. So talking about the JRC, on the next slide, we see their work on a reference method, a reference mass spectrometry, LCM-SMS method for milk protein, and there are 3 key papers. Karen Aitride et al. In 2019 published a systematic study of the optimal buffer and digestion conditions in mass spectrometry for milk protein. And then Maria Martinez Estezo and colleagues in 2020 published published the first ever reference SI traceable mass spectrometry method for the measure and total milk protein. They went on then to use that very well characterized cookie material to run an interlaboratory comparison, and you can see from the chart there that the number of laboratories who were able to return results around the incurred level were few, and you can see that some of the most off the mark results were obtained by LCM SMS at the upper right-hand side of that graph. And our own laboratory returned results, and we knew that they were results which weren't representative of what was probably truly there, because we had our own reference material to gauge our results by. And when the JRC asked me, well, why did you not correct? I said, well, I wanted to make sure that we gave a return which reflected what generally would happen in a laboratory. And there are no hard and fast rules about how you use recovery correction in allergen analysis. Do you or don't you? So that's something that you've got to decide for yourself. But at the very least, you need to use a reference material so that you know how close your result is to the true result, and that's information you can also get from a proficiency round scheme. So those 3 papers are open access and well worth having a look at. Moving on again then, reporting is a key facet of what you as an analytical service laboratory will do, and there are some, here are my suggestions for what you should be offering. And these come from work that Adrian Rogers and I did when we were teaching a course on using ELISA a couple of years ago to allergen service providers in Vienna. So what I think you should do, and most people agree, is the method of analysis. You should tell your customer what method you used, whether it was ELISA, PCR, LCM SMS, or a combination, not just a number reference to the number that the method has in your lab. At the time Adrian and I did the teaching exercise, the labs that were present were reluctant to say which ELISA platform they used, but I think that is information which the customer could make, certainly the risk assessor could make good use of. Then really, this is really important, the units. You've got to tell people whether it's the allergen protein or the allergen food. So is it egg protein or egg? Is it walnut protein or walnut? And then measurement uncertainty. That's a debatable point for many laboratories, for many parameters, but it's getting to be routine to report it for small molecules. It's obligatory in mycotoxins. There's a rule of thumb for pesticides, 50%, and for veterinary residues, again, it's mandatory. So I think really to give the customer necessary information, it should be reported. You should also mention any suspected method cross-reactivity. So your report will state X plus or minus U, the measurement uncertainty, milligrams per kilogram, as Y, where X is what you can read on the screen there, and Y is either the allergen protein or the name of the food. And then you might think about recovery correction, recovery reporting if it's not corrected. That's something for you to decide, but I feel that in the future there'll be some hard and fast guidance on that coming up. But wherever you give a number, always say whether it's protein or food. Page 1, page 2, page 3, page 10, page 50 of the report, always say every time till you're fed up looking at it, so that nobody is in any doubt what it is you're reporting. And if you report the food, you might want to give the conversion factor from the whole food to the allergen protein, because the allergen protein is the hazard. You would also want to think about contextual awareness, so that you can advise on thresholds, you can advise on assessment, you can advise on cross-reactivity, a whole host of things. But I know that those expectations of the contextual awareness and the consultancy, that doesn't come cheap. And people who use laboratories should know that allergen analysis is neither as straightforward to do nor as straightforward to interpret as other small molecule analyses. And they should be prepared to pay for a lab which has that expertise demonstrated by validation, accreditation, and PT participation. Okay, that's my platform, that's my soapbox. What's happening? What's new? So we're going to talk a little bit about a list of things that are coming up or have happened recently. And the first one, this is first because it's of global significance. It's two key position papers published by expert groups this year, one in May and one just last month. And the first one recommended the global priority allergens, and the recommendation is that these should be cereals containing gluten, crustacea, eggs, fish, milk, peanuts, sesame, and some specific tree nuts, and they're there on the screen. The working group felt that some allergens there on the screen should not be prioritized globally, but they may be important in individual jurisdictions. Equally importantly, they came up with a watch list. So what might appear as priority allergens in the near or midterm future? Pulses, insects, and other foods such as kiwi fruit. And the second report recommended, as we've seen, a set of reference doses, and they were set at the EDO5 level. And this second expert group, headed by Ben Remington and René Crevel, made it clear that looking at the clinical studies, EDO1 and EDO5 are, of course, protective of 1% and 5% of the allergic population, but symptoms up to EDO5 have been found to be mild or moderate, and not more than 5% of reactions at both EDO1 and EDO5 could be classed as anaphylaxis, but none were severe, and there were no fatal reactions in the clinical studies at or below EDO1 and EDO5. And coupled with the extreme rarity of fatal food anaphylaxis, this seems to me to suggest that we're moving away from EDO1s perhaps to EDO5s, which is less of a burden on analytical laboratories. But this particular second report issued in August did make a point of saying that better allergen analysis is required, more reference materials are required, and I would add more reference methods are required. So what else is coming up? And on the next slide, we've got just a resume of the EDO5 doses, the reference doses that the FAO Codex expert group recommended, and bear in mind these are recommendations. They have to go through the Codex labeling committee, they have to go through the Codex Alimentarius itself, and there's no guarantee they'll be adopted. Neither is there a guarantee of when they will be either rejected or adopted. It could be a medium to long timescale, and you can see there that milk and sesame is waiting for a decision pending further data analysis, and that'll come along in due course. So that's the global. What's happening in Europe? ILSI Europe Expert Group on Allergen Quantitative Risk Assessment, which I'm privileged to be the co-chair of. It's headed by Ben Remington. That first part of the slide tells you what ILSI is. Essentially, it's a not-for-profit industries group bringing together scientists from all aspects of industry, academia, and the public sector to give us good advice on a variety of topics. And this Allergen Quantitative Risk Assessment Expert Group is working on key guidance. So what is allergen QRA? So risk management. The risk management action is a function of the risk, of course, and the risk itself, as you know, is a function of the hazard and the exposure. So we know what the hazard is. It's the allergen protein. The exposure is the quantity of allergen protein consumed, and the QRA seeks to identify the allergen and quantify the exposure. And then the risk management can compare the QRA output with thresholds and critical protein concentrations, and analysis is crucial in each of these steps. So on the next slide, you'll see the timeline. We started this work in early 2020. We've been through a couple of stakeholder events, half a dozen mini workshops, another stakeholder event just recently completed last week, and now we're moving into a testing period and review. get a peer review of the entire report, which will be published January, hopefully January next year. But also we're hoping for various companies and organizations and stakeholders to test material that we published. And the next slide shows you the table of contents as it currently stands. You can see that this is a big document. It's currently sitting around 30,000 words, but there may be aspects of it that you're more interested in others. And one of them will be sampling and analysis, and I'm responsible for heading up that section of the document with help from Marianne van Ravenhurst and Simon Flanagan. And the key thing to remember is that sampling is a really important aspect, as you know, but there's very little guidance out there on how to sample for food allergens. And for the first time, we're putting our heads together to get some sampling guidance, empirical, practical, usable sampling guidance. But you can see there that this is a big document with lots of sections. What it is not, it's not an endorsement or rejection of a specific risk assessment system. It is guidance on how to identify and gather the required information, seeking to systematize this across the whole food industry. A couple more things then. Next slide is for the UK, so drilling down, Natasha's Law, this young lady, Natasha Edna Laprose, tragically died in 2016 because she picked up a baguette which contained sesame, and she didn't see whatever labeling that was there. There was no obligation at that time to put the labeling on the product, and from the 1st of October in the UK there will be an obligation to put labeling on every product, even if it's pre-packed for direct sale, and that previously you'd have to ask someone or get them to look up something and give you information across the counter. So IFST have a really good set of guidance on that on their website. Have a look at that. And then lastly, there's a knowledge hub. It's going to go live either today or tomorrow with a whole host of material that you want will be useful to anybody trying to interpret, know about food allergy, interpret results. So have a look at their homepage there on the slide. What's next? Is there one more thing? Yes, the AOAC. I'll not go through in detail, but currently AOAC have 2 working groups on allergen and gluten analysis, seeking to produce updated guidance on what kit producers and users should be looking at with regard to validation. So conclusions, and I'm sorry for running on, but very briefly, here we go. There's a crucial need, as I hope you've seen, for demonstrably accurate allergen and gluten analysis. And what do we mean by demonstrably? You need to assure your customer that you're doing it right, and I leave it to you to decide how you do that. But validation, accreditation, PT are part of the score. And you must report coherent and meaningful results so that risk assessors have a fighting chance of doing something concrete to manage the risk. And we've gone on into future development. So priority allergens continue to evolve slowly. New methods will be required for the watch list allergens, pulses, insects, and foods such as kiwi. Validation will be tightened up. We need more reference materials and more reference methods, but who's going to fund that? There's evolving harmonization, I think, of reference doses at codex level if the expert group recommendations are accepted, and that's not a given. The ILSI toolkit will be there in early next year, and then I hope will follow pressure to harmonize risk assessment, risk management, and regulation. And what will that mean? Then that translates back into the next slide, final slide, to show, of course, demonstrably accurate allergen and gluten analysis will continue to be a key requisite, and coherent and meaningful reporting. Thank you all very much for listening. The usual disclaimers, the acknowledgements of my colleagues, which you can read on the screen, and I'll hand you back now to James for the concluding slides.
Thank you, Michael. Yeah, I think one thing that is very clear is that this is a fast evolving and dense topic. So I think in a 45-minute runtime there, Michael, you gave us a great deal of value, a great deal of information. I think, as Michael did mention, that this webinar has been recorded, so please keep an eye out for an email that will provide you with a link to download the recording should you want to dwell on any more of the slides or any more indeed of Michael's words. Before we move on to any questions that we might have, I just wanted to quickly highlight some of the latest coming out of the AXIO Proficiency Testing camp in this area. I want to raise the awareness of a brand new sample that relates to food labeling, and that is sample PT-FC846. This is part of our QFCS scheme and is brand new into our scheme and is available from the 4th of October. So it's worth paying attention to now if this is something of interest. Ultimately, this is a paper exercise, and you can see on screen what will be requested of participants. And you will work with LGC AXIO Proficiency Testing in order to review your construction of a nutritional table versus other participants and understand the kind of the quality of the construction of labeling. So this is new, it's worth keeping an eye out for. So again, this does go live for the first time on the 4th of October 2021. So we have a week up until that point. So if this is something you're interested in, please do get in touch with us directly. You can find the sample on our website, and it's a food labeling benchmark exercise with a declaration of nutritional values. And what we are looking for here is an assessment to European Union food law or equivalent. So it's a paper exercise. Please keep an eye out for that brand new sample. Any questions, please contact us. Highly related to a lot of the material that Michael has walked us through today is a series of new food allergens that have been added to the AXIO Proficiency Testing portfolio. We already had a number of established and high participant allergen PT sample rounds, and we've added 5 more in 2021. You can see on the left-hand side here the table of the existing ones, but that includes samples looking for analytes such as gluten, egg white protein, almond, soy, and lactoglobulin. So those are things that are already established. If you're not taking part in those already, they are worth a really close look. New for 2021, you will find samples for gluten in pasta sauce, for soy and milk protein in non-dairy milks. You will find a sample for egg white protein and milk protein in biscuits, and also in canned meat. And finally, looking for gluten in swabs is also a sample that has been applied. Please note that a number of those samples, as a result of being so brand new, are not necessarily included in our UGAS scope of accreditation. Please review our website and the specific sample pages for more details. Across that portfolio then, what we do have is a very thorough set of samples available for testing of food allergens and then its related labeling requirements globally. So as ever, AXIO Proficiency Testing is here to support your laboratories. For those of you that are not already aware, ultimately proficiency testing is a critical tool in ensuring laboratory performance is both consistent and that the measurements are accurate and reliable. Proficiency testing is specified in ISO IEC 17025 as a key external quality assessment tool. And I think across Michael's content today, you will have got the impression that there are a number of tools at your disposal to ensure the quality of your measurement results when it comes to allergen testing. And PT is very much a part of that toolkit that is available to you. A few of the other benefits related to PT include the ability to fulfill accreditation requirements. So if your laboratory is looking to be accredited to a certain level, whether it is an ISO standard or local or global regulations, then we can help with that. It allows you to demonstrate your competency to customers and regulatory bodies. And I think in allergens, that's more important than ever, because what we're looking to do is provide reassurance to consumers ultimately that the food that they are consuming is both exactly what it says it is and indeed is safe for the individual needs. So I think that's a really key part of what we're trying to do here. It gives you an opportunity to compare results with laboratories around the world. And I think even just joining us today on this webinar, we have participants and partners from all over the world, and AXIO Proficiency Testing does offer a truly global view of laboratory participation in the world of allergens. We talked a lot today about risk assessment and risk management, and indeed proficiency testing plays a key role in managing the risk through the early warning of potential problems. So by using our PT samples, you get the opportunity to identify any inconsistencies, any potential risk to batches or testing outcomes, and it can operate as an early warning and get you ahead of the game and support your end outcomes. You can verify your methods of instrumentation. Again, fast evolving area this in the world of food allergens, but is definitely an opportunity for us to support you in making sure you are deploying the latest tools. And finally, there is a chance to use PT to educate and train staff. So if your laboratory team are using PT samples regularly, it gives everyone an opportunity to ensure that the way in which samples and testing methods are treated are both effective and consistent, whether it's in a single laboratory or a network. AXIO and LGC have been on the scene for 40 years. We are here to support you, and all of our schemes are designed on the future needs. So working with our friends such as Michael, but also many others, including a number of you attending today on the call, is key to us providing exactly what you need. We look for inputs from our partners around the globe to tell us exactly what they need from proficiency testing, and we work hard then to provide that and be the perfect partner to make sure that you have the assurance that your decision making is informed, reliable and effective. And we're proud to be a part of your testing. You can discover a great deal more about us at lgcstandards.com/AXIO. And you can contact us at axio@lgcgroup.com. Finally, what I do encourage you to do is join us in our online communities, both on LinkedIn and on Twitter. You can just search for AXIO Proficiency Testing or LGC AXIO or LGC AXIO PT, and you will find us. And we share a great deal of our content on there. Indeed, in the world of allergens, we attached a couple of reference documents to this webinar. Those are available online and will give you a little bit more insight into both what we offer, but also what we know about the allergens testing area at this moment in time. I am very conscious of time, so I will have a quick look. What we do have is a few questions, particularly on actually some of the latest PT samples, such as the swab PTs and the potential for looking at allergens in water. So with timing being a factor, I'm only having approximately 60 seconds at the most. What I would say is anyone who has asked a question, we will be taking that offline, and we will make sure the relevant expert takes a quick look at those questions, and we will come back to you directly. So you've registered for the webinar, you've supplied a question, and we will be able to get back to you, whether it's from Michael or from the AXIO Proficiency Testing team. So I would like to just end the webinar today by saying thank you very much, firstly, to Michael. So thank you, Michael, for your time and for your hard work delivering the very latest information. And finally, I'd like to say thank you to everybody for joining us today. We know that your time is precious, and we hope that this was of great value to you. Please keep an eye out for an email containing your participation certificate and also a link to the recording of the webinar to consume as you wish. And in the meantime, we'll take a good long look at these questions, and we'll come back to those of you that ask questions directly. If you need anything else at all, please do contact us or visit our website. So Michael, thank you and goodbye, and everybody else, thank you and goodbye. Take care.
Thanks everybody. Take care. All the best.